Hi, everyone. It's Dr. Jacqueline Cortez Salmons here at Transformation Health and Wellness in Anaheim Hills, California. And it is February 10th, 2021. I'm happy to join you. I'm back in my office. Yay! I know last week I broadcast from the hospital bed. I was not doing well at all. I thank you so much for everybody's well wishes. I'm doing much better. Everything is on the mend. Now, if I can just continue to hydrate on a regular basis, I have my little water bottle here, so trying to do a better job of it. But thank you again. And so I wanted to talk a little bit about my experience and kind of the follow-up aftermath of my experience. I needed to go back to my doctor's office, the specialist, to go and take care of the residual of the procedure that I underwent and make sure everything's tucked in where it's supposed to be. And I wanted to share that experience with you. Again, there was nothing really wrong. Nothing was rude. Nobody did anything that they shouldn't have. It had nothing to do with that, but it was just the fact that it was very mechanical. So I called the doctor's office and said, "Hi, I'm Jackie Cortez. I'm calling because I had a procedure in the hospital. I needed to follow up later this week. I needed to see my doctor on Friday." And they asked for my date of birth. They confirmed my name to make sure that that's who they're talking to. And that was literally the only time in my entire encounter that anybody used my name. Zero else. And really, if you look back at studies, have shown that the most personal, the most endearing thing that somebody can hear, the best word anybody can ever hear, is their name, because it's truly a part of our own identity. It's something we've heard since the time we were itty bitty tiny babies. And so we grow to that. So really to endear yourself to somebody else, to use their name in a conversation is very, very critical in kind of building relationships. So they used my name to confirm that's who they're talking to. But then apart from that, I was just the procedure from Monday and Tuesday. Okay, we have this time on Friday. We'll be happy. No, they didn't say we'll be happy to see you. We don't take your insurance, so we'll see you because you had the procedure done, but then you're going to have to find somebody else. Again, these are the facts of life. So again, it's not that they're telling me anything wrong. I'm glad that they let me know that so I don't develop this big, amazing, discussion and then can't carry it on later. But it's just kind of the way in which it's said. There was never a question of how was your experience at the hospital? Wow, that must have been very scary for you, or must have been very painful, or how are you feeling at home now? Is there anything we can get for you? Do you want me to pass any message along to the doctor? Do you have any questions? Do you know how to get here? Do you have our address? I mean, it would just really, there were no follow-up at all about any kind of humanity whatsoever, empathy, or, kind of care about what I had just been through. And again, being in such a vulnerable situation, I had to leave my own practice for a week. No money is coming in. I have to make sure my kids have childcare. Of course, thankfully, spouse at home and so forth. But nonetheless, there's a lot of other dynamics than me just being a patient for a 15-minute time slot on Friday afternoon that somebody has to go through when they're going through an experience such as that. And it's nice, I guess, if your staff can actually comment on that and have something to say about it. So then aside from that, I went to the doctor's office. Again, easy enough to find, wasn't any problem there. I came in, "Hi, how are you? Just give us your ID and your insurance card. Okay, go have a seat. Doctor will be right with you." They bring me back to a room. "Okay, go ahead, have a seat here. We'll take your vital signs. The doctor will be right in." Not, "Hi, I'm so-and-so name." I know nobody's name in the office. I have not one idea who I was talking to. They never asked to confirm, like, "Oh, are you so-and-so, are you Jackie Cortez?" Again, it's not because I'm a physician. It has nothing to do with whether I'm a physician or not. I don't want extra additional treatment. I'm a human. And just to say, "Oh, are you Jackie? Oh, I understand you were at the hospital earlier this week. Are you feeling okay?" Gosh, that must have been nothing. So it's really something that we try to bring to this practice. And I shared it with my staff that, how different of an approach we have to our patients. in that we know their story. We know why they're here. Typically, when they come here, I look at ourselves as the goalie. We tend to be the folks that people come to when they've gone through the rest of the playing field and there's kind of nobody else to give them the help or the support that they need. Then they come our direction, and we need to really value our role in that person's life and kind of understand from our patient's perspective what other factors do they have that might impair their ability to get here before 5 o'clock, or to have to come with their child or children or their spouse or a caregiver. Like, then that's okay. Bring them inside. No, they don't have to necessarily wait in the car. We have big enough rooms that can accommodate a couple of different people. So it's everything that we can do to make sure that those patients feel welcomed in our practice. Even something so simple as when patients walk in the door, we say, "Hi, we're so happy to see you. I'm glad you're here." Um, that statement alone, I have found, goes for miles for an individual. For a business to actually say, "I'm so happy you're here," and that we genuinely mean it. Like, I am so happy when people have found our practice and are seeking care for themselves, not because they're seeking care from me necessarily, but because the underlying interest there is, I want to get myself better. I want to be in a different place than where I'm at, and I want to feel well. And however we can help to facilitate that, whether it's a facial, whether it's nutrition counseling, whether it's weight loss, whether it's hydration, management of hormones, there's so many modalities in which we can help to fulfill some of those roles. And really, the basis of that is patient education as well, kind of helping them learn to care for themselves. The best thing I can ever do is have a patient graduate from my practice and not really need me a whole lot anymore. So I people see people fleeting in just to pick up their supplement and go home, or to come in for their one, their facial or what have you, but they don't need my services because they're on track and doing very well. Nothing makes me happier. And so I just kind of wanted to share that about the difference with our practice and what we try to bring to the table and to our community, compared to kind of maybe some of the experiences that you might have had at other medical offices and so forth. So feel free to comment below, that, if you've had an experience that you'd like to share, what have you, I'd love to hear from you. But we'll see you next week.